Hello. The purpose of this presentation is to review the field education requirements for the MSW Certificate in Aging and Health at the Rutgers School of Social Work. Traditional two-year students must complete an internship with a focus on aging and health in their second year of field. For advanced standing students who are admitted into the MSW program after completing their bachelor's in social work, they must complete all three of their MSW semesters in an aging and health setting. All MSW students are required to select a concentration. The field education component of the MSW Certificate in Aging and Health is open to students in both concentrations, including clinical social work as well as management and policy. Because the intent of the first year field is to provide training for generalist practice and not in any one particular field of specialization, the first year field can be in any setting. It does not necessarily need to be in aging and health for students to graduate with the certificate. However, because older adults are such a diverse group of people and the settings in which social workers work with older adults are so varied, students are encouraged to do both years of field in aging and health if they come into the MSW program knowing that they seek to build their careers and service in this area. The school's MSW Certificate in Aging and Health requires that certificate placements meet three criteria. The first criteria is that the work of the organization is at the interface of aging and health. The placement should present students with opportunities to experience people facing challenges and strengths that touch upon both aging and health-related issues. Therefore, a placement in an organization that largely serves youth and family, as an example, would not be approved for the certificate. The second criterion is that the placement exposes students, at least in part, to issues concerning healthcare policy. As an example, an organization's services might be funded in part by health insurance or through grants from private foundations dedicated to improving healthcare. The third criterion is that the organization focuses, at least in part, not just on clinical conditions and medical diseases, but also on prevention, wellness, and public health services. As an example, a cancer center might offer services for patients and caregivers to improve their well-being, such as through opportunities for guided relaxation or groups on post-traumatic growth. Aging and health field placement options are quite diverse. They include public and private organizations, inpatient, outpatient, and community care or agencies, and they address a myriad of issues faced by older adults. On this slide, you can see a few examples of common settings for certificate students. These include skilled nursing facilities that offer long-term care as well as shorter-term rehabilitation services. Hospitals, including specialized programs for older adults, general social work departments, palliative care, and oncology. Hospice organizations that are not affiliated with the larger hospital system, as well as senior housing programs that help to expand housing beyond bricks and mortar alone and to address residents' health and social service needs. There also are multi-service community-based organizations, such as Jewish Family Services and Catholic Charities. These independent, non-for-profit organizations typically offer various portfolios of services, and oftentimes they have one grouping of services specifically for older adults and caregivers. Also, there are public agencies, which are entities of the government, such as the County Office on Aging or the New Jersey State Division of Aging Services, which is located in Trenton. Activities and tasks performed by clinical social work students in the Aging and Health Certificate program vary based on the setting and students' previous work experience. However, typical tasks include conducting assessments when a person first presents to an organization, planning for clients' discharge from one setting of care to another, providing counseling to individuals and families, and providing case management services and group work. Case management tasks really vary and oftentimes go hand in hand with the provision of supportive counseling. Some examples of case management tasks include making referrals to other organizations, assisting with transitions of care, and helping with accommodations in response to sensory impairments. Group work can include development of groups and leading or co-leading the support groups, such as memory enhancement groups or caregiver support groups. Activities and tasks performed by management and policy students in the certificate program also vary based on the setting and students' previous work experience. However, these placements typically include a focus on policy, procedural reviews, advocacy, and education. For the certificate program, these tasks must have a focus working on behalf of older adults and caregivers. For example, a management policy student might help a Meals on Wheels provider do a strategic plan to integrate their services with other organizations. An intern might also take the lead in representing the concerns of older adult clients at their organization to community-wide forums. As another example, a management policy student might be responsible for increasing the number of volunteers within community-based organizations that focus on serving older adults and caregivers. Regardless of the concentration or setting, please note that organizations that work at the interface of aging and health are dynamic. This means that over the years, or sometimes even months, they can experience changes in staffing, the scope of their mission and work, as well as their interest in taking on interns. Therefore, potential field placements for certificate students change from year to year. The school has a field placement specialist who keeps track of these changes. Once you've been accepted into the Aging and Health Certificate program, you will be assigned to work with this field specialist, who will be sure to find an appropriate placement for you that will meet the certificate's criteria. In conclusion, here are 3 takeaway points from this presentation. First, the field placement for the certificate must be completed as part of the advanced internship. Placements during the generalist year field are not approved. Second, the range of possibilities for field placements for the certificate program is vast. However, approved placements share a focus on 3 areas, including work at the interface of aging and health social work, exposure to healthcare policy, and some provision of preventive, wellness, and public health services. Third and finally, students are to work closely with the field education specialist in aging to find an approved placement. It is the specialist's role to liaise between students and potential sites for the betterment of the student's education, to serve the organizations, and for our certificate program and school as a whole. This concludes this video presentation on the field requirements for the MSW Certificate in Aging and Health at the Rutgers School of Social Work. Thanks for your attention.